When life throws you a curveball, how are you going to handle adversity? Welcome to the Fearless Mindset Podcast, where you're about to go on a journey as I interview security, business, and entertainment leaders on what it takes to stay fearless. I'm your host, Mark Ludlow, and enjoy today's episode. Here's a question. You mentioned all the doctors and all the research and development. You must have scientists on staff at your company. What's the head count for doctors and scientists at your corporation?
Yeah, so we're just at the clinic level, we're pushing somewhere in the mid-50s range for staff. And that's not all scientists and doctors, but the majority, they're all medical practitioners. So we're talking about nurses, PhDs that are in the laboratory, master's level technicians that are working on their PhDs. All the rest of our doctors are MDs or higher, MDs or specialists. Like I said before, neurosurgeons and sports medicine docs and orthopedic surgeons. And we do have a couple of general docs that are working on their specialists. So that is an important differentiator. If any of your audience is thinking about stem cell therapy and wanting to look into it, whether or not you come to our company, do some research on the type of practitioners that are going to be applying this science. And then more importantly, I think to your point is you have to control the science part of it also. Mm-hmm. So stem cell is science and medicine, and it's the combination and application of the science and medicine that is the real difference. Mm-hmm. So when you just have a doctor that's buying the science and then trying to apply it, not understanding how the inner workings are and the nuance of the inner workings are very important for viability, which means results for the patient. That is a differentiator. So the clinics that don't have their own laboratory, that aren't controlling their entire process, they have no real skin in the game with each other. The laboratory is like a pharmaceutical company that its sole job is to create cells and sell the cells. And they don't care if they're effective or not. They just need to sell cells. And when they sell them to the practitioner that doesn't know about the cells, it's just not a great combination. So yeah, we control the entire process. We have a laboratory, treatment facility, innovation center, everything from IP, from soup to nuts.
Wow. So you just explained the differentiator from competition that you have versus your in-house. You're basically a hospital that provides all solutions to the byproduct.
100%. And it's extremely important. Yeah, it's extremely important for results. If you want safety and you want efficacy, that's what you look for in the company.
Now, where do most of your doctor graduates come from? Are they from all over the world? Are they from America, Europe? Where do they come from?
No, most of ours are from from Colombia, where I am here. Okay. But most of them are trained outside of the U.S., meaning a lot of them go to Europe, a lot of them go to the United States. They have a similar fellowship program. So to back up a little bit, one of the reasons that I picked Colombia is, number one, I was looking for a place close, in the Western Hemisphere. I didn't want to go all the way to Southeast Asia or other countries that are much further that also have good regulation. So I was looking for a country that had good regulation for stem cell therapy. And then I was looking for a very robust medical system. And, as we talked about before, back in the 80s and 90s, Colombia, it was a war zone. There was a lot of bad stuff going on here because of the drug trade.
Sure.
What that did, though, is it created this incredible medical system because it was a war zone. So they started by having some of the best trauma surgeons in the world. If you're in medicine, people from all around the world came here to train for trauma because it was 30 years of war,
Makes sense.
essentially. Okay. But that also helped proliferate this medical infrastructure where now, doctors tend to have, a lot of nepotism in the way that they continue that profession. Doctors breed doctors a lot of times. And so now it's been decades and decades and decades of these very high level surgeons creating more doctors that are going into different specialties. So the medical system here is very robust. That's what I was looking for number two. So the doctors here, I put them up against anybody in any part of the world. But, they're also trained in the US and Europe to get that other level.
Sure. I'm researching some good questions for you. that I want the audience to know about, because the audience is listening going, whoa, what the heck is this? Hey, what are some interesting 101 facts about stem cell treatments that we haven't talked about yet?
Well, that we haven't talked about. I was starting to get into it. I suppose the 101 facts that I'd like to convey to your audience is some I started talking about. Not all stem cell companies are alike just because they say that we do stem cell. Not all stem cells are alike just because they're stem cells. There's hematopoietic stem cells and mesenchymal stem cells, and they're not all as potent and effective as you need them to be. So you kind of want to look for the companies that do the mesenchymal, or some parts of the world will call them mesenchymal, but the mesenchymal stem cells, the acronym is MSC. Not all stem cells are alike. And so those two things alone are a good 101. Not all stem cell companies are alike just because they're doing stem cell. Not all stem cells are alike. And, certainly, stem cells themselves are vastly different in their efficacy.
Okay. I think we tapped on this a little bit, but what are the biggest success stories you've heard involving treatments and stuff like that from your patients? What are some stories that you could share?
Yeah, we're blessed to have a lot of the professional athletes that are very vocal on whatever social handle they're most on. You see TikTok stars and Instagram guys and YouTube stars, but it's not the athletes that are most remarkable, even though we see guys that were hurt maybe at the end of their career and then we extend their career or they're champs again. That's awesome. Yeah. But really, it's the everyday patients that are in chronic pain. They don't have a ton of money, so this is a big investment. And they come back to us, and they come to us skeptical. They're afraid that they have to go to what's seen as a violent third world country, and we're administering experimental medical technology, and it's not covered by insurance. And so these are the people that I feel for the most. And when they come back to us and say, thank you, Eric, and thank you, the medical team, you guys have saved my life or changed my life dramatically. That's the best. And I can tell you that the coolest thing, and I'll tell you one story specifically. Sure. There's, I call him a friend at this point, but his name is Dustin Bunch. He was a former firefighter, lived in California, was at the lake with his family, at Lake Havasu with his family, like he did every 4th of July weekend. He had his boat with his daughter and his wife and their friends. And just like he did every year, he dove off the boat. And this year, the water was low. The water level was low. So he had an immediate spinal cord injury, was paralyzed or quadriplegic immediately. He almost drowned because of it. Luckily, he was with a lot of his firefighter buddies that knew how to resuscitate him and get him to the emergency center immediately. And anyway, the point is the first time I met Dustin, he was down here in Colombia, and he was obviously in a wheelchair. He's quadriplegic, and he had this major life-changing trauma. And I kind of asked him, I said something like, what exactly are you expecting from the stem cell therapy? Because this is very experimental, and you have the worst injury on the planet. So this is by far the hardest thing to probably try to fix. And, so just a fact-finding mission for myself on what he really wanted to get out of it. And he just said, Eric, if I could hold my daughter again just once, that would be it for me. And so, that was a challenge. But I'm happy to say that after several treatments, he's no longer a quadriplegic. He's had several levels of changes. Wow. He's able to move his arms. He is able to feed himself. So now it's a benefit to his caretaker as well, that doesn't have to get him a drink and feed him every second. He's holding his daughter like he requested. He's able to control his bowels and his bladder again. So it's a different dignity in life as well. And I'm happy to report that he's starting a foundation, America Strong, where he's going to help other spinal cord injury patients in their journey back to hopefully a better health. So, we've changed his life dramatically. And it wasn't just the stem cell. Dustin has maybe the key component, which is tough mental strength. So he was out there. He wasn't laying in bed saying, woe is me. He was out there doing the physical therapy and the alternative therapies and all the complements to stem cell. It's not just the stem cell as a shot is the miracle. It's a combination of a lot of things. And that's something that we believe in as well.
I mean, that's powerful. You just changed that guy's life. Just an average, like you said, average guy, firefighter, you changed his life. And went for that dive, and most normal stories, he'd be down to a wheelchair, but because of your technology made a life-changing effect, and he can continue living his life through recovery.
Mark, here's the thing, is that doctors in the United States told him that was it. Sorry, you're about as far as you're going to get. Do some physical therapy, but you're never going to walk again. You're never going to move your arms again. And, he's not out walking around. He does have some movement in his legs with physical therapy. It's assisted, and, I don't want to oversell it. He's not going to be running marathons or anything like that. But the point is that I hear this from our spinal cord injury patients all the time, where doctors, they just don't know. They think that their lives are over, and they're not doomed to that wheelchair necessarily. We do have patients that have gotten out of the wheelchair.
See, we were talking about this because my dad died of brain cancer, and I'm thinking to myself, well, my dad's going through the journey of brain cancer as a watch destroy his mind and finally take him away. Is there really possibly a cure out there for cancer, but the drug administrations, the pharmaceutical companies don't want us to know about it because there's so much money in treatment and pill popping? I'm just like my curious mind going, Like now, as I get older, I'm a Marine Corps veteran, and I served under Bill Clinton and Hillary, so I'm not really political because I've seen enough, I've heard enough as a military guy. I was wondering, maybe there is a treatment out there for cancer, and maybe it's taking a guy like yourself to go, hey, we have it, but in this country, you have to leave the American country to discover what we can do with cancer treatment, because everybody gets affected by cancer. We have cancer cells in our blood system, but it's going to take a guy like yourself to say, hey, try this, it might work. And then all of a sudden it works. And like, holy crap, why have we been holding this a secret for so long?
Yeah, I mean, the crummy part about what I have to do as an entrepreneur is I have to take a great company like this and take it offshore. And I would do that, all day, every day to help more people. And that's what we're doing. But it would be nice if we could do this in the United States. And the truth is that the FDA knows. The FDA sends representatives to our conferences, and they know, and they've done hearings where hundreds and hundreds of patients have come in and begged the FDA to allow them or their families to do this onshore, because it's a barrier to getting this therapy. If you can't go to your local doctor or somewhere close and affordable, and you have to go all the way to South America, that's a barrier for a lot of Americans that are now not accessing this technology. So it's unfortunate. Speaking specifically about cancer, one of the reasons that, it's hard to describe our company, we're somewhere in between a life science company and we focus on biotechnology. And the reason that I say cellular therapy,
sure,
because it's not just stem cells. There are other cellular therapies that are incredibly advanced, including CAR T therapy, which is a specific treatment for some types of cancers, mostly solid tumor cancers. There's also great therapies out there on the cellular level for blood-related cancers like leukemia. So you definitely can't say cure because it doesn't work for everybody, just like any other medical treatment on the planet. There's not 100% success rate, but there's some remarkable results. There are some people that have essentially been in permanent remission because of cellular therapies. Now, I don't put stem cell in that category. There are other therapies like CAR T. Stem cell is, and what we do does not treat cancer. So that's not what we do specifically, but to answer your question, yeah, there's some remarkable technology out there. And unfortunately, most of it's offshore.
Yeah, it makes me question, like, if you're a person of wealth, well-to-do, and you have access to those kind of funds, I mean, there's nothing to say if money creates a lot of options for somebody of extreme wealth. And I'm sure there's always things that are in trial processes that are not approved by FDA. And, you go over to Europe or South America like yourself, and there could be some other proven, really amazing, like miracle treatments that are happening. And as science keeps evolving, we find cures for different things out of nowhere, because in the R&D processing of science, all of a sudden, this Viagra pill is good for high blood pressure too. It's like, right. Oh, who would have thought the blue pill?
Yeah, exactly. Yeah, there's, once you have contact with our patients, and I'm fortunate enough to have daily contact, it's not just the chronic pain and the neurological conditions and the orthopedic conditions that come here. It's also people that are looking for longevity. It's those ultra high net worth people that you're talking about. It's the heads of state. It's the rock stars. It's the movie stars. They have a different level of access to information, unfortunately, because of money in a lot of cases, but they do have access. And so that's why they visit us, because this is, for a lot of scientists, and certainly the celebrities and the heads of state that I was talking about, they believe that stem cell is a component to let's call it the fountain of youth, but to longevity. And so it's health optimization and longevity. And when you're optimizing your health through other alternatives, and we do that also, we do things like cryotherapy and red light therapy and hyperbaric chamber oxygen and ozone therapy, and a whole host of other complementive and supportive therapies to stem cell. But stem cell is the more unique and advanced technology of those alternatives. But if you start stacking those along with each other, you find people traveling all over the world for these alternatives that I believe are going to help us feel really, really good when we're in our hundreds.
Beautiful. And for those listening on the podcast here on audio form, I got Eric Stoffers. Is it Stoffers? Is that correct?
Stoffers, yeah.
Stoffers. Yep. And Eric's the CEO of BioXcellerator. And it's an amazing technology. Are you guys trademarked at all, or South America maybe?
Yeah, we're trademarked in the US, all over the world. And it's BioXcellerator. We also have a concept called BioX Health. But BioXcellerator is our innovation center, life science company where we research, develop intellectual property. But then the best part is that we actually apply it because we're offshore. So we're actually helping patients right now.
So folks, there you have it. It's just basically, if you heard of the Fountain of Youth, folks, well, they have it. They design it. It's legal in South America, and they have people from all over the world, all walks of life, your super high net worth family to athletes like frankmir and Bella, friends of mine that actually use it. They get treated, but this is your Fountain of Youth. And if you're a veteran, you're struggling with pain issues and all that, hey, look them up. They're on, are you guys on LinkedIn? I looked around for LinkedIn.
Yeah, for sure. We're on all social platforms, even TikTok. But yeah, LinkedIn is great. I would say that if your patients or your audience is really interested in becoming a patient or interested in what we're doing, especially interested in results, look at our YouTube channel. There's a great platform there where you can see both the facility, the doctors, but the patients, what they've suffered from, and then more importantly, their results. That's a great place. Otherwise, bioaccelerator.com is a good wealth of information, and Instagram and Facebook and whatever's good for you, we're on it.
So yeah, folks, if you're listening, you're law enforcement, you had a bad back injury with your duty belt, pulled your spine out. I have a lot of friends in law enforcement where I started my career in bodyguard work in LA. Well, 80% of them were retired medically out because of spine injuries with that duty belt. So, folks, this could be your answer. This could be something you need to look into to check in, because maybe it's changed your life, change your health, and get out of bed and go surfing the beaches of Southern California, and heck, go to South America, pay Eric a visit and his team.
Yeah, absolutely. We actually just had, you said surfer. If you look at our YouTube channel, the last video that was posted was a guy that was just back here for the second time. He was a professional surfer, couldn't surf anymore at all. So for over a year, he wasn't able to surf. He came here because of a spine and disc issue. And after his first treatment, and it takes some time for your body to regenerate. But now he's surfing every single day, 3, 4, 5 hours a day. And he just came back for a touch up because he wanted to stay in the game longer. So works for surfers too.
Awesome. And folks, Eric's a proven CEO. He ran a multi-million-dollar company, a public traded REIT, before he started this. So he knows what he's doing in business. He's leading this business down there in South America. And if he's living down there, it's got to be safe. And how big is your facility down there? I'm envisioning a huge hospital with thousands of people working and going, coming and going. But is that inaccurate?
The feel is very much like that because we're in a medical tower that has hundreds of specialists. And so there's people in and out getting treatment in whatever specialty that they're in. That's not our facility. Our facility is an entire floor in that building, but it's dedicated to us. And so we take our patient safety and also, amenity into account. So a lot of times because of our celebrities and heads of state and that kind of thing, we wanted to be a little more protective. So there's not a lot of people in and out of our facility unless you're credentialed, but it is a facility that rivals anything that you would see in the US. We're a US based company. So it's the care, the facility, the infrastructure, everything that you would find in the US, except for we have a more advanced science that you can find. And I think we have a better level of care too. So important thing to say about that also for the unadventurous, we've also housed our facility. And this is another thing that sets us apart from other clinics. When you drive across the border to Tijuana and you have to go through, all of that hustle and bustle and danger. And then you go to the facility and you have to drive back through Tijuana. Ours isn't like that. You come here, you have a concierge that picks you up at the airport. They take you directly to our hotel. Our hotel is connected to a mall that rivals anything that you would see in LA or Scottsdale or wherever your hometown is. This is one of the best malls I've ever been in. Has an amusement park in it. It has any high-end store that you need, or Rolex or Chanel, or it has grocery stores, organic grocery stores. So if you forget your toothbrush or you want some lemonade, it has all that. And then that's connected to our facility. So for the unadventurous, you never have to leave the roof. You can stay contained in your medical tourism compound. But for those of you that are adventurous, it's a cool vacation too. Colombia is a beautiful state.
So if you're listening, guys and gals, you're in your 50s or your 30s, you got injuries, you can't get the help you want by the chiropractor or the massage therapist doesn't hit it, reach out to them, folks. They could change your life. And, I got to bring this up. I was kind of hesitant about the marijuana thing, CBD cream and all that. I didn't know if I was going to start making me high every time I took it. And I said, I got to give it a shot. And I have a bad back in my neck, my spine from military injuries and all that. And I've been taking CBD cream probably the last, 3 years since I've launched it. I hardly take ibuprofen. I hardly ever do Tylenol, and just a little bit of ice and the cream on there. Boom. I'm like, I've been here for an hour and usually I'm really fidgety, but I put the cream on before our talk. I'm fine. It just, it takes this inflation away. So you got to be open to alternative medicine. There's plant-based medicines out there that we don't know about, because I really believe that, the pharmaceutical companies really control, who makes the money, who doesn't. And that's just my personal opinion, but it's just, I think, go ahead.
They get their most of their small molecule stuff, from plants. They're onto it. They know that the plants are the medicine.
They are.
Just found a way to control it. So yeah, things like CBD, most of our patients use CBD because what we try to do is prepare your body and make it as anti-inflammatory as possible before the stem cell therapy. So we actually suggest CBD to a lot of our athletes as a pre-treatment and post-treatment. So yeah, we're behind all alternatives in most cases.
Because it's true though, inflammation is the biggest cause of disease.
Yeah, the first thing,
all that type of stuff.
Yep. The first thing that mesenchymal stem cells do is they reduce inflammation.
Wow. Okay. Wow. I learned something new today. I had no idea. We're killing it on the show. So folks listening to this, you should be taking notes right now. And if you're not, you got to replay this podcast and play it backwards and forwards, because there's a lot of gold nuggets that Eric shares about just medically and how to treat your body. And Eric, I got to ask you, what is the menu? What does the menu look like for an average visit, just for like a minimal, basic to advanced? What do those US dollars cost? Or is that kind of your trade secrets? You can't discuss that, or how does that all work?
No, I'm happy to give you a range. The problem is that, once people come to us and let's say it's an athlete like frankmir, they typically come to us and they say, Eric, I've got this nagging injury. It's my shoulder. But they have like 50 other injuries that are just not as bad and not as advanced. So we start talking about the shoulder, and then we, that might be one price, like, let's say 7 or 8 or 10,000, whatever. And then once they really get into the system and they talk to our doctors and they find out how beneficial stem cell will be for all of their joints, but then also systemically as an IV, we typically have patients that end up stacking it on. If they've got to make a trip to South America and they really want to do the best for their body, typically a treatment is about $20,000, somewhere in that range. Now that could go up or down based on what we're treating, because there's a wide variety of treatments. Orthopedic injuries are a minimal treatment. Aesthetic stuff like face and hair, that's a minimal cost. But if you get all the way up into the most severe things like spinal cord injury, where people are quadriplegics, and that takes multiple years of treatments, that could be much more in the $40,000 or $50,000 range.
Yeah, as part of your job as the CEO, you're out there raising capital too for R&D too, right? Not only do you marketing, but you do a lot of things behind the scenes.
Yeah, for sure. It is a capital intensive company as you're in growth mode. Of course, we are a research and development company. So it's great that we're creating intellectual property that we now know works and works really well. And for the future, that'll be great for our stakeholders. But, in the meantime, we have to spend a lot of money on research, and some of that research could come up to be not so beneficial, in the sense that we could spend a year and a lot of money on research and say, that didn't work as well as we had hoped. And this is, one of the pharmaceutical problems, right? Is, they claim that they put so much money into it, and they do. And they have to go through clinical trials in the FDA that take 20, 25 years. That's a barrier for a lot of good technology. So that's certainly one of my focuses, is making sure the company always has enough money.
Always the problem being a CEO. Capital and invoicing and having the product. But yeah, kudos to you to what you're doing and changing lives and making people's lives better. I mean, that's not an easy task. You have to do it in a different country due to the bylaws here in the United States. Yeah, no, it's easy when you love what you do. When I get to see patients on a daily basis that either write me an email or our staff shares an email that has been written, or a phone call or a text message, it makes everything super easy. As stressful as the day might be, you forget all about it when you get those texts. There you go. Folks, thanks for joining us on this podcast with Eric, CEO of BioXcellerator. Is that correct, Eric? BioXcellerator. Yeah. And you can actually research him on Maximum Magazine, where he did an op-ed article on that. It was pretty fascinating. And again, frankmir, two-time UFC world heavyweight patient of theirs, along as bellamir. Bella is now 3-0 in her fighting career at 18. And I think Bella's going to kick some butt out there. Jeez. As much as we love Chris Cyborg, I think it's going to be a good thing that Cyborg will probably be retired by that time, because Bella's going to be a beast. There's no doubt. Yeah. Holy cow. I'm just impressed but she's got so much of Frank in her. Just that determination look in her face. And like, holy crap. I couldn't believe she took that one last fight. It was down in less than 2 minutes. I'm like, dang, crushed it. Yeah. But folks, if you're just joining us, just check out YouTube is where you can find Eric's website for BioXcellerator. They're on LinkedIn as well. And I'll be posting this on other handles. I'll be working with Eric's team as far as their social media handles and all that, so we can spread that out for social media. And you just go to their website, reach out to them if you have questions, comments, or just questions on how they can help you. So with that said, we appreciate Eric's time, as he's very busy running the company down there in South America. And it looks like a very beautiful day out that window, and it's a little overcast, it looks like. But hey, he's in South America, and I don't see any shots being fired, and it sounds safe and peaceful. So why don't you go check out, take a vacation, and get some treatment while you're at it. So, Eric, do you have any parting words to the audience before we wrap it up? No, just a thanks to you, and thanks for getting the word out to your audience. Thanks for the opportunity. Certainly, if anybody knows anybody that wants stem cell, we'd be happy to educate them, whether they do business with us or somebody else. We'll at least point you in the right direction and give you a yay or nay whether or not you're a candidate. Because a lot of companies out there will tell you yes before they even know anything about you. We won't do that. Otherwise, no, thanks for the opportunity. It's good chatting with you today, Mark. You bet. Not a problem. Happy to help you on the podcast. And folks, if you're listening to this on YouTube, please subscribe and make a comment and like our page. That's how you get traction on social media, is YouTube. So we're on there as well. So please support us there. Follow us on our Simplecast is I think where we're at, the Fearless Mindset Podcast, Instagram, we're there, B. Mark Ludlow on Twitter and LinkedIn. So please follow us and support the show.